Hello everyone, it's Dr. Huynh from West Valley Naturopathic Center. Today I would like to have a discussion about heavy metal exposure and toxicity in children. Heavy metal exposure and toxicity in children is a serious public concern in the US with the potential impacts on neurodevelopment, behavior, and overall health. Heavy metal displays the essential mineral in the body such as zinc and iron that are required for neurotransmitter production as well as many processes in our body. And heavy metal induce oxidative stress which reduce neuroplasticity and impair learning and behavior and as well as many other damage in the body. Children are particularly vulnerable due to their developing bodies and higher intake to body weight ratio. Source of heavy metal exposure include contaminated food, especially baby food, contaminated water and cultural products, toys, and many heavy metals that are the concern, including mercury, lead, arsenic, cadmium, aluminum, etc. There are studies that show that prenatal mercury exposure measured through sample of cord blood is associated with ADHD symptoms in children. A systemic review of more than 40 studies show that mercury levels are higher in the people with autism compared to the controls. Mercury contained in ambient air is linked to an increased prevalence of autism in children. So I want to touch a little bit on the picture of aluminum and childhood vaccine. Aluminum is an adjuvant that being added in some childhood vaccine. It is said to be safe because the contain is the amount is very small, and the adjuvant, the aluminum, enhance the body immune system response to the vaccine, thus help improve the efficacy of the vaccine. And the conventional medicine claim that the amount of aluminum is so small that it's safe for healthy children to clear out of their body. I do think that childhood vaccine is very controversial, and this should be personal choice based on individual cases. Aluminum accumulate in immune cell of the brain, and this can provoke an inflammatory immune response that affect neurological function and behavior. There are some tips to avoid the exposure or continuing exposure to heavy metal, including choose a very good water filter system in the home. The conventional rice chicken has been shown to have higher arsenic content. So if you eat chicken, please choose organic and free range and eat in moderation. And there are wild-caught fish that in the list to have higher mercury content and some that have a lower mercury content. Some of the lower mercury content can be wild-caught Alaskan salmon, wild-caught Pacific sardine, and pole-caught albacore tuna. And then the one that has higher mercury content can be Atlantic cod, halibut, shark, and swordfish. The Monterey Bay Aquarium Seafood Watch program is a helpful tool for learning which types of seafood are highest and lowest in mercury. Rice from India and many regions in the world tend to be higher in arsenic. White rice from California is show to how lower arsenic content, and thus a safer consideration. Um, if you have children and you work in a manufacturing, construction, or any profession that involve heavy metal exposure, make sure to change and bath immediately after work. Wash your clothes separately so that to avoid continuing exposure and avoid contaminating your home and your family member with heavy metal. So if you have any question, if you would like to discuss more, we are here to discuss with you more about heavy metal exposure, toxicity, as well as prevention and treatment.